Okay, everyone, welcome. I will just get rid of the waiting room so that people can come straight in and let everyone get sorted. And I'd like to welcome you all to this presentation on gaming the vaccine using red teaming and serious games to support risk assessment and contingency planning. As many or most of you know, I'm Rex Brynen from the Department of Political Science here at McGill University. And with me very happily today is my collaborator on this project, Ben Taylor, who's a senior defense scientist at Defense Research and Development Canada, the research wing of the Department of National Defense. He's worked as an analyst both for the Canadian and British governments, supporting national force development planning. In recent years, he's led efforts to introduce war games to this work in Canada. And in 2021, he developed games to explore policymaking by governments facing pandemics. Indeed, there's a bit of an irony here that entirely coincidentally, both Ben and I were working on epidemic pandemic related games before this even happened. He was working on them in the global context. I was working them in the agricultural biosecurity field, and then COVID-19 arrived. So the two of us will be presenting. There'll be opportunity for questions at the end. What I will do first, obviously, is share my screen so that you can actually see the PowerPoint. So hopefully someone can tell me if they can't see that, but in the assumption that everyone can, we could start. So some of this, for those of you who are Canadian, and most of the people here on the call today are Canadian, you will know all of this, but of course some of you aren't, and so I thought it'd be worth reviewing it. Canada, of course, is a federal system, 10 provinces, 3 northern territories, and under the Constitution, the provinces have responsibility for healthcare. Now, it's a little more complicated than that because a significant portion for provincial health of the funding for provincial healthcare comes to the federal government. So about 60% of health spending in Canada is subject to the Canada Health Act, which regulates what provinces have to do in order to get federal transfers. And the Constitution, of course, gives the federal government responsibility for peace, order, and good government, which might be thought to cover a pandemic as well. In terms of the specific response to something like COVID-19, the Public Health Agency of Canada, which was established in the wake of the SARS crisis, is the federal government agency responsible for public health, emergency preparedness and response, disease control and prevention. Health Canada is responsible for the approval of vaccines. We have a National Advisory Committee on Immunization that is independent and provides recommendations on vaccine use. Public Services and Procurement Canada is the federal department responsible for procurement. That means getting hold of the vaccines in the first place in response to COVID-19. And on top of that, it's the provinces who are actually handling vaccination for the most part. So when Canada was beginning with thinking about its vaccine rollout, which occurred, of course, at the beginning of last year, there were a lot of moving parts to consider. National Advisory Committee on Immunization had to advise Health Canada on the vaccines. Health Canada had to approve the vaccines. Public Health Agency of Canada had to think about their deployment. Federal government had to procure the vaccine from the US and Europe. A vaccine rollout task force was established in which Canadian Armed Forces personnel were brought in to help with logistics and planning to the Public Health Agency of Canada. Those vaccines had to be got to 10 provinces and 3 territories, which would then administer them. It is up to them on how they're administering them according to their own processes, policies, priorities, and so forth. The federal government, however, had some direct responsibility for immunization in the case of certain populations, federal prisoners, Canadian Armed Forces, RCMP, some Indigenous communities. And then security for all of this is a combination of responsibility of local police, provincial police where they exist, RCMP, maybe not the military, and the federal intelligence community as well. So there were an awful lot of moving parts in obtaining the vaccine and getting it out to Canadians over the past year. So what could go wrong? What could go wrong in all of this detailed planning to bring millions of vaccines into Canada, get them to 10 provinces, 3 territories, and a number of federal government agencies, and get them into the arms of millions and millions of Canadians? Vaccine Rollout Task Force decided to run a war game, or a game. It came from the military side of the VRTF, the initial impulse to have a game. They had no clear idea what it would look like. They said, game this out and find out what might go wrong. The fact that there was no clear initial conception on how this would look or how it would run, I think turned out to be an asset rather than a liability in the game design. And that request essentially came from people at the Vaccine Rollout Task Force, both Canadian Forces and Public Health Agency of Canada, and it came to Ben at DRDC, and I was involved from the beginning as well. So this request, game out what could go wrong with the vaccine rollout, suddenly arrived on our laps. Yeah.
So we had to figure out how we're going to approach this problem, and we established early on rule 1: do no harm. We are dealing now with very, very busy people. There's an international crisis unfolding. Vaccines are about to arrive in the country. Nobody's done this before. And the people working the Vaccine Rollout Task Force and the Public Health Agency of Canada stakeholders are absolutely critical people. Whatever we did, we had to totally minimize the contact we had with them. However, they're the key people. They are the experts. They have to be engaged. So we had to both, on one hand, not disturb them, but also disturb them when it really mattered. And so balancing these two sort of different priorities was sort of really a key for us. Also, we had a very, very tight timescale to do all of this. So everything had to be done rapidly. Everything was going to have to be done through structured judgment sessions. There's absolutely no time to build complex models, simulations, anything like that. It's all going to be done by people talking in rooms together. But also, given that where we were at the end of November in 2020, everything had to be virtual. Everybody's working from home. Everybody's building new ways of working. So we couldn't actually get any 2 people face-to-face in a room at all. Everything is sort of been run virtually. Next slide, please. So there's an overall architecture for doing this was firstly to bring in an independent red team, people who are not actually directly involved in the vaccine planning, but nonetheless could bring perspectives into this to look at the planning as it was evolving, look at the scenario, look at the planned vaccine rollout, and look at what might happen. Take the plan, look at what could happen to it to create these a form of sort of set of contingencies, things that might happen during the rollout. We would then convene actual planners, people's job it was going to be to make this really happen, into a sort of tabletop or virtual tabletop exercise, for them to then look at the problems that we wanted to throw at them, which weren't necessarily the problems that they would have thought of themselves. As has been noted, I think, by Thomas Shanning, nobody, no matter how clever they are, can possibly write down a list of the things that wouldn't occur to them. Hopefully our red team came up with some things that wouldn't have occurred to the planners. The planners would have to look at them and come up with mitigating courses of action. We would then reconvene the red team and say, well, here are the things we thought could go wrong. Here's what the planners thought they could do about them. Given, in your opinion, do you now feel that this, partially mitigates this? What's the residual risk left after all the mitigations that the planners came up with would be put into practice? What is left over that we still haven't considered? So this 3-week exercise, end-to-end, red team, plan tabletop exercise, red team again. Over to you, Rex.
So let me start with the red teaming. And although we were initially asked to wargame or game this out, we decided very early on that a game wasn't enough. Running one game or one tabletop exercise was just one walk through history, one set of possible contingencies. There's a limit to how many you can insert in a day-long tabletop exercise. And we knew a lot more things could go wrong than we could possibly capture in a day-long tabletop exercise. So the red teaming was a very important process of not only generating contingencies to explore the tabletop exercise, but also generating a larger list of things that could go wrong, not all of which would be in the tabletop exercise, but would go in our ultimate report for the Public Health Agency of Canada and the Vaccine Rollout Task Force. So we very quickly established red teams using essentially our professional networks, retired senior public servants, police officers, military healthcare experts, academic public health experts, foreign service officers, researchers in social media and misinformation. So we took a very broad group of different expertise from public health to all the other things that would relate to the vaccine rollout. And we held 4 sessions with them, each focusing on one part of the plan. So procurement of vaccines, their initial arrival in Canada, then their distribution to the provinces and territories, then ramping up vaccine administration, getting the numbers higher, and then finally transition to a steady state. Those were the phases of the main plan. The red team were all given a briefing on the main plan, and then we sat down virtually on Zoom and identified things that could go wrong. And so each of those red team sessions generated a long list of what we thought could go wrong and how it would go wrong in each of those 4 phases.
Okay, so having done that, we reached a project plan where we found there was a slight blip in the plan in that we hadn't given ourselves the time to actually fully design the table of exercise. So weekend 1 became building the table of exercise. We had, from the red team, a large set of contingencies, as Rex has described, but we needed to carefully manage the set that we would actually ask the planners to engage with, giving them the huge list that wouldn't give any time to make sure they looked at things consistently, wouldn't give them the sort of the time to think things through. So we pulled out perhaps a representative 2 or 3 contingencies for each of the phases of a plan for the players to actually, or participants to dive into and look at. A mixture of things which were sort of the more likely ones, but also potentially disruptive, but we're not looking for the real sort of outlier. So we had the material to put together to give us 4 sessions for the 4 different phases of the operation. Whilst we were putting this together, the rollout team were themselves building the participant list. Now, as well as the planners at Public Health Agency of Canada, there are many more organizations implemented, as Rex has sort of identified from some of the earlier slides. We had multiple federal departments and agencies, provincial governments and territorial governments, all are stakeholders in this overall process. So out went the feelers and we got some people. Actually, we were amazed. We had 150 people registered. There's a little asterisk there to note in case there are any Americans present. 150 people coming to a workshop in Canada is vast. This was a major exercise to put together. As I said, with all of these 8 different federal departments and agencies, provinces, territories, and the Canadian Red Cross, and with participants spread over 6 time zones, all had to be coordinated and planned for the execution. Okay, next slide, please. So here's an example of the kind of material we offered people. So for all of these contingencies, we sort of wrote a short paragraph about what's happening, what's going on, and then created these sort of news, fake sort of news website sort of headlines just as keys, as a sort of cue to the issue going on. And many of these things are quite straightforward, and you'll recognize some of the stories here as things that sort of may or may not have actually really happened. Our first one was a fire at a Madrid vaccine production facility. Well, you may remember there was actually a retooling of a factory in Belgium went on. So a factory went offline, that disrupted. So that's an example. We had a placeholder for something like that, and something just like that really did happen. All of the details were different. So you'll see in there a mixture of things you'll recognize and other things that you won't because they actually didn't happen, or at least not as far as we know. So next slide, please. So then we look at the execution of the actual virtual TTX. It was a single day exercise. 4 sessions played, each looking at a different phase of the plan. But we recognize that some people were subject matter experts for only part of it, or due to other sort of diary commitments, could only be there for part of the time. So each of those 4 phases had to be a self-contained session with its own introduction, its own working and its own sort of brief out and wrap up. So 4 replicated blocks set through the day. Participants who were with us were assigned to one of 4 different breakout groups. Many of you will be familiar with the idea that asking one big meeting to discuss something will get you 1 set of thoughts, but breaking it into 4 different meetings to discuss the same topic, you'll get 4 different narrative threads, 4 different perspectives. But we grouped them and themed them so that different sorts of people were in different sorts of conversations. But in order to make this work, we already had staff from the Public Health Agency of Canada who were already earmarked to be the recorders, the facilitators, and to provide the back briefs. So there was not that, we avoided that sort of awkward time at the beginning of a syndicate breakout where everybody looks the other way when somebody has to be nominated as a spokesperson. This was all set up in advance, so it ran very, very quickly. And as we've said, the entire event was 100% virtual and run over WebEx. So the team at Defence Research Development in Canada had been developing techniques for conducting analytical war games online during the pandemic shutdowns, and that put us fortuitously in a very good position. We had the skills, we had the technology, we had the software, but we also had the tradecraft in how to actually manage multi-breakout room exercises, how to coordinate them, how to run a control team in the back. This is something we'd already done, and we were able to turn that on and deliver that for the event. We also did have some senior facilitators and observers, so there was some very senior visitors, both military and civilian, appeared, and we were able to meet them, greet them, talk to them, and escort them around virtually and show them what was going on without that breaking into the overall execution of the TTX. So all of this was managed and executed successfully without any sort of technical glitches and flaws on the way through. Next slide, please. And here is that sort of breakdown of a turn structure. So each segment, we had a 15-minute introduction to explain what's going on, how it's going to work, the broad context of that particular phase of the plan, and the selected contingencies we wanted them to look at. So we then broke them out, as I said, broke them into 4 parallel rooms. The first one was entirely made up of public health agency planners. So they got together to have their discussion of their plan. We then had a second room that contained people from other federal departments and agencies. They were taking a national, federal sort of top-down perspective, but not from the position of owning the actual distribution. Third room, provinces and territories. And again, as we've said earlier, these are the people who are receiving vaccines at the end of the rollout process and then had to work out how they're going to use it, store it, and make use of it. So they have a particular perspective from sort of what are those people in Ottawa doing for us to look at. But we also then had sort of room 4, where we had a mixture of people from all sorts of backgrounds to see whether we could get some sort of cross-cutting sort of conversations and going. So each of those 4 rooms tackled the particular problems in parallel. And then there's a 30-minute session at the end for those 4 groups, all to brief what they had come up with out, and then to try and rapidly produce a synthesis of key points emerging. Next slide, please. And then finally, in here, we have the second red team. We brought a red team back in the 3rd week. Some slightly different members were there, just unavoidable. But we then asked them to view the likelihood and severity of each of the contingencies before and after the mitigations provided by the TTX. We did this in a structured way because this was done very quickly in one afternoon, but we produced standardized word ladders of what sort of very likely, totally unlikely, impossible meant in terms of percentages and likelihood, and also provided polling tools. So instead of the panel having to have an actual debate and try and drive consensus, they were very easily able to simply express an opinion, press a button, and we very quickly saw, yes, there's a broad consensus. This is unlikely to happen. It was previously very likely to happen before mitigation. So moved through very, very quickly. And the results of that were all condensed, tabulated, reported back to the Public Health Agency clients to label them to then take that forward in their subsequent risk management process. Back to you, Rex.
Okay, so what effect did this all have? We had a very, very short period of weeks, and just before the vaccine rollout was about to occur, we had these red team meetings that had identified literally dozens of things that had gone wrong. We'd taken just short of a dozen of those and run them through the day-long TTX to see how people thought they would deal with them. And then we'd had this final red team session to sort of evaluate whether we thought the mitigation measures that had been identified would be enough. I think that the process met the federal government's urgent need to indicate to Canadians that planning was well in hand amid, and you may remember at this time, just before the vaccine became available, lots of media reports that the federal government was being too slow on vaccine rollout. Indeed, the execution of the tabletop exercise was announced in a national press briefing the following day. Within government, a summary report of issues was first, an out briefing from the whole process was first briefed to the Public Health Agency of Canada senior leadership, then on to the Prime Minister and members of the federal cabinet and the Vice Chair of the now Health Minister of the federal cabinet's COVID-19 committee, then had a follow-up briefing to ask questions about things that had been identified in the TTX.
We're also holding simulation tests. The distribution to test the distribution plan in consultation with all partners, stakeholders, through a series of tabletop exercises and rehearsals, one of which occurred yesterday. This is to ensure that critical capability gaps are filled, the risks are mitigated and well identified, that the plan is resilient, contingencies are put in place, and it's the start of a dialogue with a number of interactors. In short, our plan is to secure movement of the vaccine supply chain from manufacturer to each of those individuals, each individual that will be immunized by a licensed healthcare provider in Canada. So we're very much collaborating at an unprecedented level with stakeholders and partners to plan and execute a timely, fair, well-synchronized distribution of vaccines to all Canadians.
So the feedback from the sessions most immediately was very positive, but Ben and I thought it would be useful to go back and look at the process about a year later and see whether it indeed had been as useful as we hoped it would be. So that's what we've subsequently done. The risk assessment undertaken encouraged the Public Health Agency of Canada to sort of formalize and further develop its internal process for risk-based analysis. The approach that we had taken sort of accidentally aligned with the preference of the Privy Council Office for risk assessment, so that there was a real market for the kind of product that we were producing at the cabinet level, and Public Health Agency of Canada has carried that forward in the way that they do risk assessment. It enabled a nationwide dialogue amongst public health officials on vaccine challenges, and at this point, many of the provinces either had not fully talked to federal counterparts, or not all of them had, but they also hadn't talked to each other. So the opportunity to be sitting in a day-long TTX and discuss perspectives, we got a lot of people found that very useful. And public health officials were, quote, immunized by pre-exposures to contingencies and challenges. That is to say, not everything we identified came up, and we didn't catch absolutely everything that came up, but there were many things that were in the red teaming or were in the TTX that indeed did come up. And hopefully the idea is that by having thought about them in advance, you're better able to respond to them. We've gone and talked to some of the people who were in the process, and some of them still in the process. I won't go reading the long quotes here, but the feedback we've received was that it was very useful, that had this not occurred, it might have taken longer to think through how to deal with the contingencies that did occur when vaccine rollout occurred. So here one Public Health Agency of Canada official is saying it would have been a more challenging space had we not practiced on some of these contingencies in advance. Here we can see one of the Canadian Armed Forces planners saying it seemed this was a good way of getting an outside check about the things we were planning on doing and what might work and what might not work, that was appreciated by senior leadership. Another interview with the Public Health Agency of Canada official saying that again, this sort of immunization notion that by running through the things that might go wrong before they go wrong, people had a faster and more effective response to those sorts of contingencies. So we were quite pleased, and also the level of collaboration, the opportunity to talk these things through in a big day-long setting was something else that our interviewees have said to us in terms of the value of the project. We did also do, both immediately afterwards and roughly a year later, polling of participants. I do have those numbers. I haven't put them on here because the response rate is quite low, but that gets to the point that Ben has mentioned. Everyone has been super busy with COVID, and we had to make sure we weren't taking too much time away from actually planning and doing in this sort of red teaming and TTX process. But the numbers of the polling of was it useful have been very positive too.
So 13 months could be a short time in defense analysis. So defense projects are known for running for years, if not decades. 13 months is a very quick time, but it's a very, very long time in dealing with the COVID-19 crisis. Canadian perceptions have moved. When we were at this point, sort of December 2020, no vaccines had so far arrived. There was much press concern about how Canada was somehow seen as behind. The government was paralyzed and incompetent, and it was terrible. But since that point, the situation turned around dramatically. Canada has been, after initially slightly slow start in early 2021, Canada has been close to, if not ahead of most other major nations in terms of vaccines delivered. When we look at the different things that happened in the time since we ran this exercise, the one thing that the red team did not identify, which we might have included in the contingency list, was the arrival of variants of concern. The idea that there were the vaccine was mutating and could possibly mutate. The viruses might mutate, mutating and could possibly escape the vaccines. That wasn't foreseen as a contingency, and that has been a significant issue. What we also, though, did identify some things that we thought might be concerns, which, as it turned out, haven't actually manifested. The Pfizer vaccine, in particular, required ultra-low temperature distribution and storage, and we could think of all sorts of technical, logistical problems that could have brought about. As it was, it seems not to have happened, and in many cases, the parameters under which the vaccine has to be stored and moved have actually become a lot easier and easier to sort of to meet the requirements. Direct action by vaccination groups hasn't happened. Blockading ports of entry and storage facilities or hospitals hasn't been seen. Major cyber disruptions taking advantage of the healthcare, attacking the healthcare system during the vaccine rollout, we've not seen that. And major criminal exploitation by either black market vaccines or the production of counterfeit vaccines by organized crime. With the things we envisaged could happen, and thankfully these things have not manifested as in a significant degree to affect us. Next slide, please. And here is a chart up to date, sort of showing us roughly where we are. We can see the Canadian line did in the early months was a little bit behind because the curves of the large pack of groups coming through. But by the time we reach the middle of 2021, the Canadian line is above the other comparator sort of major nations in the European Union. So this demonstrates that it worked in the end. Looking at lessons for the analytical community, though here, the design, preparation, execution of this was very, very quick. It happened in a 1-month window. And that is not easy to pull off. There are a number of reasons why we did this. One of them, perhaps, as I referred to earlier, is the idea of a warm base of tools and techniques. We knew how to run a distributed war game. We had much that we could do. We had already available to us to allow us to run this kind of exercise. There were senior staff, Rex, myself, and some of the other people involved. We have extensive personal networks. We know people, and we know people who know people. And between us, we were able to very quickly pull together a very informed and engaged group of stakeholders, of red team participants. We had a team that worked. We just had to just do it, and we were able to just work across boundaries do what had to be done, make it work. And lastly, an important issue, and it reflects a comment that Rex made quite near the beginning of the presentation, the senior leaders felt a need to do this kind of thing, but didn't know what it was that they actually needed and let us run with it. And we came up with something that seemed to have hit the targets. It's had a lasting impact, was positively received. And that gave us the space in which to work. We didn't have to keep reporting back progress to have things reviewed and approved before we can move to the next step. We just did it, and the event was delivered. So it raises a few questions to ask all of us, to which we wish we knew the answers. Within a formal hierarchical organization, how do you promote the idea of network informality? Having a culture which both wants to control, create hierarchy, but at the same time wants you to be able to just go do it. And how to switch between those modes within one organization is a real challenge. And secondly, there was a very clear lesson here that retired civil servants and other officials proved to be an extremely valuable red teaming resource. People who have worked in an area, they know it well, they know the subject matter, they know the people, the organizations, they know the reality of doing it because they did it, but it's no longer their job. They're not under the same time pressures. We're not taking the real planners away by asking a former planner to look at this. And also perhaps people feel a little more free to give of their time and their opinions without thinking so much of the organizational optics and sensitivities of what they're expressing. So we found it was a tremendous resource that we could tap into. A number of retired individuals were invaluable contributors to the red team.
Okay, so at this point, there are already a bunch of questions, some in the chat and a hand raised. So you could do it either way. What I think I'll do is we'll go back and forth. So I might start off by addressing the question, the first set of questions in the chat from Justin, then we'll go to you, Dave, with a hand raised, and then we'll go back again. I'll start, Ben, and you can jump in whenever you want. So Justin asks, he's curious as to if and how the red team participants assessed and prioritized the various contingencies that they developed. Was there some kind of rubric or checklist that they used to decide which ones made the cut? In the first 4 red teaming sessions before the TTX mill, there was some discussion of them, and in some cases we refined the definition of them, but it was, here's what the plan is. Okay, let's go run the table. Who can think of things that could go wrong? Okay, what would that exactly look like? What would that mean? And continue around the table until we had a very long list. And that list went from everything from the US won't allow us access to vaccines we've purchased, which happened, to an Icelandic volcano explosion interfering with cross-Atlantic air freight, which is something that's happened in the past, but fortunately has so far not happened in COVID-19. Perhaps I shouldn't mention it in case I jinx it. But it was a very, very long list. Later on in the risk mitigation part, it was a more formalized process of evaluating things. There's a later question about what does a word ladder mean from Simone. That is just assigning probabilities to words like, or phrases like very likely, likely, even chance, unlikely, very unlikely. It's a habit or an approach that's particularly borrowed from the intelligence community, where you want to make sure that your terminology is understood in similar ways across all receivers of that terminology. Ben, I don't know if you want to add anything about that. Slightly skipping questions from.
Yeah, we'll just touch briefly on the issue of the word letters. It's about creating scales. Instead of inviting people to say, how would you express the severity of a snowstorm, for example, if you have a series of statements, there's no disruption, there is minor delays to travel, there are significant blockages and advisory to stay at home to total whiteout, nobody will go anywhere. You have 4 possible cases. People can say this is a 2 or that would be a 3. So it's just very, very easy to get people into the same conversation around the same language. And we use that kind of structure in many sort of judgment based exercises and analysis in all sorts of different domains.
Okay, going back to questions, I'll just address Justin's other 2 questions, then we'll go to you, Dave. What happened to the contingencies that didn't make the cut? So all the contingencies were briefed at the end, higher up. But so both the ones that were in the tabletop exercise and those that weren't, and that was deliberate because we felt that one of the dangers of running a TTX was that it was just you couldn't have much more than 10 contingencies in it because of time. And there were lots of other things that could go wrong. And we thought that just the TTX standing alone was misleading. We put in the contingencies we thought were most useful for the TTX, but we wanted to make sure the others were in the briefing and we're also in the risk mitigation that Ben has just talked about. Would it have been better to keep the red team membership consistent between weeks 1 and 3, or did this change? The red teaming was partly an availability sample. We were literally emailing people and said, are you free on Wednesday next week? Because that is the amount of time we had from the first time that we got the call, we've been asked to do this, how would you do it, to when we started running things. We were on a very, very, very tight time frame. But also it switched somewhat because in the various red team sessions, there were different focus. So on initial procurement, we needed to have more representation from Global Affairs Canada because some of that got into our diplomatic engagement with vaccine producing countries. Other things were more logistics or public health focused. So the composition of the red teams varied both for practical reasons and also for thematic reasons. The participation in the TTX varied based on the interests of participants and their time availability, because lots of public health officials rather across Canada did not necessarily have a full 7 hours to devote to a TTX, although a great many of them were there for the full 7 hours. So I think that that addresses sort of questions 2 and 3. Dave, your hand is up. Ask your question.
Hi, Doc. Thanks a lot. Can you hear me okay?
Yes, we can.
Doc, I'm from the Army Simulation Center, and over the last few years, we've done a number of exercises with various government agencies, including some to do with health-related issues. But you mentioned contingencies that you represented as potential threats to the successful rollout. Did you take into account the political environment in each of the provinces? Because that could affect how a provincial government decides to roll things out or not. I'm interested to know if you took that into account or not.
That politics was, I mean, it was discussed in all those, in both the red team context and the TTX, how free participants in the TTX felt to talk about it, given that they're public health officials who work for political masters, I think is an open question. There were no real constraints in talking about that in the red teaming. It does have to be remembered, this relates to a question that Justin has in there about variants. We were focused on the vaccine rollout as a logistical and organization exercise. In other words, the health issue of what happens if there's another variant 9 months from now was both outside the time frame of the plan that we were asked to stress test, and in some ways outside the kind of decision making we wanted to explore. Our primary focus was, can we get any vaccine? Can we get it to Canada? How on earth will we get it across Canada? How will we make sure the provinces can handle it? What political pressures or blowback or difficulties might occur? Who might try to interfere with that? What would happen if suddenly our vaccine supply was cut by 50%, or there was a giant ice storm in Eastern Canada and the logistics providers couldn't move it? Those were the kinds of things we were primarily focused on, as opposed to the broader medical issues. Now, in terms of the ongoing work in the Public Health Agency of Canada, that stuff is being addressed, but that was kind of outside both our time frame and our remit for the most part. But I would identify variants as kind of the thing I would have liked to us to put in, even though it wasn't really in our remit. But again, we're just dealing with the first months of the vaccine rollout. So we were dealing with the period in sort of December, January, February into the summer was the time frame, the arrival of so-called steady state. Longer term things were outside our remit.
Yeah, just like to come back to your question, Dave, about on the politics. What we did not do is set up particular provinces with particular political characters and say what happens if this premier does that, or because that was never going to be sort of what we wanted to look at. What we did have with some contingencies that were looking at the possibility that provinces would come back to the federal government and want to sort of renegotiate or change the distribution policy. The policy followed was a per capita basis. And if you were the government of a population, of a province that had a far higher infection rate than others, you might legitimately want to go back to the federal authorities and say, hang on, I've got proportionately twice as many people infected in my province as the guy next door. Why don't I get twice as many vaccines proportionally to deal with it? Which is a legitimate point of view, and in fact, one that we saw raise at different times when provinces had surges. They said, federal government, you need to give us more because we're in crisis. So we actually did foresee that argument being made by provinces, and we had that as one of the contingencies. So in some ways, but we were making sure we did not want to name names, point things at specific provinces, but a generalized case of a province feels it's been hard done by, it comes back and wants a different distribution. That was something we did have built in.
There's a
Okay,
really
thank you very much. Thank you.
There's a really good question in there, Ben, about what would we do differently if we could redo it? What would you do differently if you could redo it? Perhaps not work with me. I don't know. But
I think it's so there are some times when you just hit a sweet spot and things just seem to work, and you can't recreate those sort of the perfect circumstances. There are other instances where you could try the same model and run into a client director general who wanted to personally review all the slides before they could be shown on the screen and delay the start. Or you could have had there's a huge number of things could go wrong in executing this kind of exercise. So in terms of what we would have done differently, giving ourselves a little more time to make sure that we've thought of and set up the materials we wanted to use, have some breathing time in between, enable to create perhaps a slightly more structured form of report so that we could advice in, catalog all the various things we'd identified, and provide more of an analytical study of what we'd done. As it was, though, those options did not exist because, as Rex has said, this was urgent. This was in the public eye. As a professional analyst in government, when I know that my work's about to be talked about at a national pest briefing, I normally cringe and want to hide under my desk because something's probably gone horribly wrong and somebody has released something they shouldn't have done. In this case, we see sort of the public face of government saying, somebody's done this, we are moving out, we've done something, we've got good, vibes are good, we're in progress. So the opportunity, so the fact that us wrapping up the last session of the TTX and General Fortan taking part in the government's daily press briefing, was 36 hours separated, if that. There's no time to do a study, to do a report, things have to move at the speed they did. So it's a good question, what would have done differently? I don't know that we could have done anything significantly different, given the time frame we were under and the sort of organizational sort of impetus climate of the time. But Rex, welcome.
yeah, so it's hard to, it went better than we had any right to imagine it would go, given the amount of time we had, I think. So I was very pleased with it. The one thing I could think of was at the last minute, someone discovered we couldn't record the TTX sections in WebEx because of federal government privacy rules, and we had to use scribes to record the conversations, and that I would have much preferred to have had that all audio recorded, which we weren't able to do. We had to do note taking, but we did the note taking. A number of Canadian Forces personnel were suddenly told they were note takers, but that worked fine. I will say one thing that made it all work, and I'm going to praise Ben here to his embarrassment, is that the whole team at DRDC, not just Ben, jumped on this right away enthusiastically with a great deal of energy, long before they were officially asked to do so. I think that the tasking memo asking DRDC to do this probably arrived 7 days after we'd started doing it all, by which time there were a significant number of people at DRDC who'd put aside what they were working on to make sure that this happened in time. Now, those of you who've worked in federal and other bureaucracies will know that that is not always the way bureaucracy operates. You don't always ask a completely different government department if they will help you with something. in the case of Public Health Agency of Canada, asking DRDC, and they start doing it even before the paperwork and the memos and the tasking has happened. So that it had DRDC not responded so enthusiastically and informally, it probably would have been impossible to do. But that gets back to this kind of network informality, which I think exists in the serious gaming community in and around the federal government. There's a lot of people who casually talk. Some of them are even asking questions in the chat, who are sort of in an interaction quite often, and that made things happen much more quickly than would have necessarily have been the case. Okay, so Madeline Johnson, who's one of the, for those of you who know who Madeline is, I'm going to blow her horn. She's the strategic gaming advisor at Global Affairs Canada, Canada being one of the few foreign ministries in the world that has someone who's dedicated to the application of gaming methodologies for policy development. So well done, GAC, and well done, Madeline. Asks about how the process and outcome has fed into ongoing FAC work. The comments we've received, since neither of us are at the Public Health Agency Canada, is that it was useful at the time and it changed the way that Public Health Agency, modified the way that Public Health Agency Canada was doing contingency planning. So we've talked to people who still do the risk assessment at Public Health Agency Canada, and we've been told this was very useful. We saw how useful it was, and we decided to do not exactly the same thing, but to have a structured process of risk assessment in an ongoing way where we're generating risk assessment products regularly to brief up both within the agency and across the government. Next question, this was sent in direct message, so you can't all see it. We're Red Team members. Did we do any indoctrination or onboard training for the participants? No, we had no time. It was literally the week before, chasing down people. So we'd have roughly a dozen, probably about a dozen, maybe a bit less in a few cases, people in each of the Red Team sessions. So we had no time to do any onboard training. I mean, this literally started with Cole Peterson, Lieutenant Colonel Cole Peterson, Canadian Armed Forces, giving me a call and me saying, you got to bring Ben in, and then running from there in terms of structuring. It was a very, very short time frame because everyone was doing, as we were doing this, the plans were still being developed, and those plans were extraordinarily detailed. I mean, I still have one of the early PowerPoints in which it estimates the number of aluminum ice cream scoops that are needed across the country in order to be able to scoop dry ice into the holding containers for the Myrna vaccines. So with the level of planning involved, someone working out the number of aluminum ice cream scoops you would possibly need to have on hand, and someone at procurement having to make sure that those are available. That's the level of detailed planning. Madeline's doing a great job of continuing to be one of the key hubs of strategic gaming in Canada by posting in the chat her contact information. And incidentally, I will mention, and in fact, I will bring it up on the slides now. These are the participant surveys. As you can see, overwhelmingly, people thought that the tabletop exercise was useful or very useful in, for example, the third one there, identifying challenges. But that's not what I wanted to do. There is a annual serious gaming conference in Canada, Connections North, which is next month. So I will leave that up for anyone who's interested. It's free, and lots of us will be there. Question from Robert: were the reporter scribes in the TTX given any specific instructions to capture ideas that were dropped? Weak signals, less than we would have liked, because that was occurring very quickly, and it was only a few days before we ran that we were informed we couldn't record the proceedings, and therefore had to run around and find scribes. Any requests for follow-on games? Not to us from within the Public Health Agency of Canada. I know that, Ben, you did have a request at DRDC to do some other gaming, and indeed have also done some other pandemic gaming since. I've been working on pandemic gaming in a very different context with Save the Children and Johns Hopkins and the Ready Initiative. And very soon there will be a digital outbreak simulation launched for humanitarian team leaders, but that may be another presentation at another time. But I don't know, Ben, if you want to say anything about other pandemic gaming you've been doing.
Just briefly mentioned that we did have an exercise we ran using a similar kind of model that was used to support the Canada Border Services Agency at the point where the US land border was reopened. There was a lot of concern as to what would happen, who would come to the border, what paperwork would they have. And a similar kind of exercise in first looking at all the things that might happen, then having an exercise where people came together and talked about these various contingencies. So the model is sort of portable. But that was a version. It didn't have the huge number of participating organizations. But it was done as a significant effort was undertaken. Very briefly, just to sort of explain, to give a feel for sort of who we are and what we do, I have been developing sort of a classroom game where teams of players play the leaders of of countries that are facing a pandemic. And those players have to make strategy decisions as to what they wish to do with sort of their business sector and the travel restrictions and the health investments. And behind the scenes models show the infection moving, and that's being used in classrooms at Simon Fraser University. And I can see Professor Kelly Lee from that group is on this call, on this presentation here. Good to see you, Kelly. So this is something that's sort of a different kind of game, but nonetheless, there are similarities. What you see is when somebody is placed in a sort of a simulated game kind of environment, if it's done right, there's a sense of engagement and a sense of ownership and a sense of energy. Seeing a class of students trying to get their country through a pandemic over a video link is really a rewarding experience to sort of see that. And similarly here, nobody was along for the ride to see what happened, to see what it looked like. People were really passionately engaged. Team members, the planning group, people from all the different provincial and territorial groups and the Red Cross. People gave themselves into this, immersed themselves in the environment and went for it. And without that, none of it works. No game works without its players. And these participants here, and again, the class of students I've had a pleasure to work with that briefly at Simon Fraser, they engage and they get something out of it, which is great to see.
So there's a question there about the full list of federal participants, and we just gave a number. We didn't give a number of the agencies, but if I remember correctly, Public Health Agency of Canada, and of course Health Canada, Canadian Armed Forces, and of course Department of National Defence, Global Affairs Canada, Public Safety, Indigenous Services Canada, Correctional Services Canada, CSIS. I think that's probably about it. I'm trying to remember who was there. I don't have the list in front of me, but that's from, in terms of federal participants, that's more or less who was there. I might have missed an agency and so forth. So and Kelly's saying nice things about Ben too and his games in the chat there. So it's say nice things about Federal Public Servants Day here at online. Any other comments or questions? Have I missed? Have I missed any? Ben, do you see any that I've missed, or hands up?
I don't know.
I think, one of the things was, a couple of points to make. Ben mentioned how we were given relatively free rein. I will also say that senior management were very tolerant of us dealing with some potentially sensitive issues. I won't get into what the issue is, but there was one issue that we had in the TTX that had emerged from the red teaming, in which higher up, there was a concern about it being politically sensitive. Our response was, yes, it is. That's why we need to have it in the TTX, because it would be politically sensitive. And the response from higher up was, okay, that makes sense. That can be a problem. There can be a time when senior management do not want you to game difficult things because the risk of leaks or blowback or bringing out problems in the agency or the planning or what have you. We had none of that. We had no one saying you can't do this because it'll make us look bad. we had free reign to explore stuff that went wrong. So that's very positive. And as Stephen Downes Martin at the Naval War College has endlessly written about in the literature on wargaming, that is not always the case. Sponsors do not always want to hear bad news, but we did not have that problem at all. And I wanted to underline that in terms of our ability to organize a game. Any other questions? If there aren't any other questions, I'm happy to hang around informally for a bit. It's just like one of my classes at McGill, now that we're in virtual teaching again, I always hang around after class. If you're interested, particularly if you're in the federal government, you're interested in the application of serious gaming, do get in touch with Madeline, because she has a very long email list that she sends all kinds of interesting stuff out on when it's organized in a series of regular brown bag sessions now within the federal government. We have a disadvantage compared to our southern neighbors, where the Department of Defense in the US and its associated defense contractors probably have 100-fold more serious gamers, war gamers, than we have here in the North. We have the advantage that because we're so small, we all talk to each other, and there's an awful lot of cross-fertilization across government agencies and departments, and I'm in a university, across universities, and that's quite positive to have that kind of multidisciplinarity. Okay, so thank you all for being here. I'll stop the video, and I will hang around for a bit if anyone wants to talk about things informally. Otherwise, I hope you enjoyed the presentation.
Yeah, thank you all. Have a great week.
So if anyone does have anything, stick your hand up. Otherwise, Ben and I will get back to things Ben and I will do when we're not making presentations. Okay, thank you all, and goodbye.
Bye.